Hi and welcome to my video blog. My name is Uzo Ehiog. I'm a physiotherapist and also a strength and conditioning specialist in the UK. So today what we're going to talk about aging and the older athlete and you. So although voluntary participation in physical activity as we get older is not commonly associated with aging animals and also humans. However, there are many exceptions of that, and many record-breaking feats that have taken place by older athletes over the years. A good case in point is a chap called Clarence Dumas. Clarence Dumas was a marathoner, and when he was 42, he came seventh. When he was 42, he won his 17th Boston Marathon. By the time he was 65, he'd come 78th out of a field of about 153 runners in the Boston Marathon. So it was a pretty significant achievement at that grand old age. Now, the research across the board effectively tells us that we can expect to see a decline in aerobic fitness and also muscle strength and performance in the region of about 1 to 2% per year. So that's about 10% per decade. And that normally starts from about the age of between 20 to 35 years of age. So for many of us, it's already started. However, an important question is, can you delay the decline in physical performance if you participate in a physical exercise program? Well, the evidence from the research is pretty conclusive. You can. So it's really important. So physical fitness isn't necessarily associated with the function of aging, and this is because when older athletes have been compared to less fit individuals of a similar age, those that have been active have shown a significantly slower decline in physical fitness and performance because of their regular participation in physical activity. So today the focus is on cardiovascular fitness or aerobic fitness. So cardiovascular fitness is very, very important for health and wellness, and that has been established over many years. However, we can expect there to be some decline with aging, and normally this is affected by some important factors, and those factors are lung function, heart function, and the extraction of oxygen from within the blood and it getting to your working muscles. We can't do very much about lung function because that will decline as we age, and there's very little we can change there. However, we can change heart function, which is a very powerful muscle, if not the most powerful muscle within the human body, because we need it to survive and live. Equally so as well, the extraction, or the body's ability to extract oxygen from the blood and to post it into your working muscles is also changeable, and it's related to the atrial venous oxygen difference. So in terms of recommendations for exercise for older populations, the recommendations come from the American College of Sports Medicine. The American College of Sports Medicine is the preeminent organization within the world that looks at all of the available research around physical activity, exercise science, strength and conditioning and performance. What they then do, they then compile it, and they essentially give us guidance or guidelines on what we should be doing based upon the best available research. So in terms of the recommendations and the prescription, let's think about the frequency of exercise. So in terms of the frequency, it should be between 3 to 5 days per week. You should aim to do something. Now, in terms of the time or the duration, okay, you should aim to accumulate at least 30 minutes of physical exercise over that 3 to 5 day period. Now, it's okay if you accumulate that. So you could say do 10-minute bouts, 10-minute bouts of cardiovascular exercise through the period of a day. that is completely permissible and something we would recommend. In terms of the intensity, so the intensity is really about how hard are you working. The first thing you need to be able to do is you need to be able to measure the intensity. So there are many sophisticated ways to do that, heart rate monitors and the such like. However, if you're on a budget, the best way to do it is to scale it using a visual analog scale of, say, between 0 and 10. 0 being at rest, you are at rest and you are not exerting yourself, and 10 being the hardest, toughest amount of physical exercise you've ever done, completely out of breath, cannot continue doing it for more than a few seconds. So you should aim to place yourself around the 5 to 6 mark. So that is moderate. The intensity is moderate. So you should ideally be able to have a conversation with somebody whilst you're participating in physical exercise. Okay, not a prolonged conversation, but certainly you should be able to have bouts of conversation with someone next to you without getting out of breath. Now, the type of exercise. Now, this is quite important. Now, the type of exercise, okay, it's really up to you. Okay, what you want is exercise which uses large muscle groups. So things like brisk walking, things like cycling as an example, elliptical trainers in gyms. Now, again, if you're on a budget, then some of the best things you can use are brisk walking. Brisk walking costs nothing. And all you need is the outdoors for that. However, if you have joint, bone and orthopedic problems, brisk walking may not be something which you can use. So stationary cycling now becomes the next option, and it's a very good option and it's a very inexpensive option. So stationary cycles can now be bought very inexpensively. So places like eBay are great. You can pick up stationary cycles, you know, sometimes for under £100, which is still in good condition. Amazon is also a good place as well. You can pick up stationary cycles, you know, brand new, sometimes for under £200. You know, it doesn't need to be the all singing and all dancing cycles that you find in gymnasiums. They just need to be safe. The good thing is they are pretty portable. You know, and it means that you can exercise indoors, in the comfort of your home, whilst watching the television, watching a DVD or such like, and still actually be training your body in a very useful way. Things like aquatic exercise, so exercise in water, hydrotherapy and aqua aerobics in swimming pools, they are very good. However, they're not very practical because you have to get there. Stationary cycling is a much better alternative. However, now I must place some caveats, and these caveats are around safety and exercise. So there are a couple of things. If you have cardiovascular disease of any sort, then you must speak to a healthcare practitioner or your general practitioner before participating in an exercise. If you've had chest pain within the last month, whether involved in physical exertion or not, again, it's important to speak to your general practitioner or other healthcare professional before participating in an exercise program. Equally so, if you're taking any medication at the moment for cardiovascular disease or things like high cholesterol or high blood pressure, again, it's important that you speak to a healthcare professional before participating in a physical exercise program. If you've lost consciousness or you become dizzy whilst participating in physically exerting activities, and it could just be walking up the stairs as an example, then again, for safety, it's important that you it's important that you contact a healthcare professional or your general practitioner to seek advice before participation in exercise. In general, exercise is safe, but it's important that if you have those caveats that I've mentioned, that you just seek the guidance first of a qualified healthcare practitioner. Okay, so I hope you've enjoyed this blog. There'll be more coming out on a weekly basis, and good health to you. Okay, speak to you soon. Okay, bye bye.